This for the end of the video, and that's why it's at the end of the links. But this is the it would be the coup d'etat, but the thing is, it's important. This is by far the most important thing that people understand. Okay, so this is talking about Horsham Clinic, which is a place where I had been from the off and on from the age of 11 to the age of 18. Okay. And I was in their adolescent unit. There's adolescent 1 and adolescent 2. I don't know if there still is. They might have changed that. But the point that I would make is this, okay? People need to understand. Now, when I was there in 1999, I believe it was, it might have been 1998, there was a girl that had stated that she was uncomfortable around the staff because literally 100% of the staff, besides the nurse, was African American, and she was her stepfather was African American, and he did some things to her that he shouldn't have done to her at the age of 14. And this guy, a 14-year-old girl, is who he's talking to, mind you. This is not somebody that's 20 or 25 or 30. This is a 14-year-old girl. Now, this is not this gentleman. This is another gentleman that did this. Okay, so, but this guy that I'm talking about, and this is who they employ. The place is full of people like this that vehemently hate white people and take their role as employees of this, where they are in charge of white children as a means to abuse these children physically, emotionally, and in some cases sexually, like you're going to see here. So what had happened was, when I was there, this guy, after she had stated that she was uncomfortable around people and wanted to speak to somebody that was Caucasian. Mind you, this girl is the one that had the traumatic experience. This is the girl that, you know, had the issues. So he straddles the chair in the group room in front of everybody, including 3 psych techs, which are the people that jump on you if you act up, and starts screaming in her face, and literally so close he was spitting in her face, stating to her, "You enjoyed it, you enjoyed it, you enjoyed it, you quote, white bitch," is what he had said to her repeatedly. And then people will go, well, if that really happened, that would be reported. If that really happened, that would be reported. Who are you going to report it to? Everybody that knows it happened in the locked facility, in the locked unit that you can't leave? These children, you have to remember, these are children that are aged, in adolescent 2, I believe they were age 13 to 18 or 13 to 17. You have to understand, these are children. A lot of them are on the younger side of that spectrum, that have either been forcibly taken away from their loved ones and are not allowed to communicate with their loved ones. They've been forcibly taken away because their loved ones have refused psychiatric services or some other thing, and the system has stepped in and removed these children and placed them in psychiatric care because their parents may have refused psychiatric care because the school said you need to get this kid psychiatric care and the parents said no. Or it's another situation where the loved ones don't love them, which is what my situation was, okay? But the fact of the matter is, these children who have experienced extremely traumatic events are being placed into a locked facility with no contact to the outside world. Who are they going to tell? The other people that are working there, that are in on it, that are also vehemently hateful towards white people? Think about that. Okay? And that's why nothing gets reported. But in this situation, this guy wasn't necessarily hateful toward this girl. Maybe he liked her a little too much. So let's watch this right here. But what I want to point out is the reason why this is coming up is the CSP, the Community Support Program that supposedly wants to advocate for the mentally ill, took food for their 2023 picnic from this agency. Now, how can they advocate for the public? How can they advocate for the mentally ill when they are taking resources from a mental health clinic that employs people like this? And believe me, they know they employ people like this. They most likely knew exactly what this gentleman was doing until he got caught. The only reason they got rid of him is because he got caught, not because of what he was doing.
Mother is horrified tonight. She says an employee at a clinic where she sent her teenage daughter for help preyed upon her daughter. Tonight, she is sharing her story. Eyewitness News reporter Jasmine Payouth is in Hatfield with that story. Jasmine, good evening.
Good evening, Yuki. That mother believes this case is far from closed. The suspect involved arrested and now faces more than 80 charges.
He asked her to send pictures of herself masturbating, nude pictures. And she did, and he also sent her pictures.
Horrifying explicit details this mother wished she never had to disclose. Conversations with her 16-year-old daughter and a staffer here at Horsham Clinic in Montgomery County.
Wrote his phone number on the paper, and he wrote the word shush underneath it. And they had been speaking and sexting, and he's been... I kind of felt like he controlled her. He groomed her.
The mother, who asked that she remain anonymous as her daughter met Tayyib Innes as an inpatient here in March. In September, she notified Hatfield Township Police, whose investigation revealed her worst fears.
Someone who's supposed to be in a position to help you and support you. Unfortunately, he was a predator.
According to the Montgomery County District Attorney's Office, the 24-year-old suspect sent texts like, "At the end of the day, you're protected and I'm not," and tried to make arrangements for a sexual encounter in the back of a car.
There were days with my daughter where you could see the depression, and it was just like she wore it like it was a thick, warm sweater. I just hope he knows and realizes the pain that he has inflicted on a child.
Horsham Clinic responded to the investigation.
This is what people don't understand. She's asking if he realizes the pain he's inflicted on a child. Does she really think that this guy cares that he's inflicting pain on a child? He's done this probably a gazillion times before to other children. He is a psychopath.
A child.
Horsham Clinic responded to the investigation by firing Innes and saying in part, "We condemn the behavior allegedly displayed by the individual as it is inconsistent with our standards and values." This mother speaking with Eyewitness News because she's fearful there are other young girls fighting the same battle.
Oh, there
Cases
are.
like this, they're unfortunately just the perfect victims. And because of that, maybe they're afraid of not being believed. But I just hope that if there are other victims, that they will come.
As I stated, it's not even that they're not going to be believed. They can't tell anybody because everybody's in on it. Who are you going to tell? A lot of these people don't have parents. Or if they do have parents, their parents are doing things to them they shouldn't be doing to them.
Forward.
We reached out to the suspect's attorney on record. We have not heard back. Anyone with information on this is asked to contact the Hatfield Township Police Department. We're live in Hatfield Township. Jasmine Payouth.
So, after I was fired from Pendel Mental Health Center for insubordination, the gentleman that they had hired to replace me, was literally a convicted bank robber. And what's funny is at the time, in the state of Pennsylvania, it was illegal for felons to work in mental health. I know this because at the time I had to pass a state police and FBI background check before I was allowed to be hired. Now with this gentleman, Pendel Mental Health's supervisory and human resources staff looked the other way because he was banging one of the therapist's family members. Okay, so it's about nepotism. It's all about nepotism. Okay, now, how did I find out this gentleman worked at Pendel Mental Health? I did a whole video about this called Pendel Mental Health Employs a Literal Bank Robber. Pendel Mental Health is another agency that receives representation at CSP. Unfortunately, it looks like I'm not going to be able to read this article. Maybe I will, maybe I won't. But his name is William Curtis. Look it up yourself. Mount Pocono, Bucks County man, charged in May bank robbery in 2000. This is from 2000 and 9. Now let's listen to the article. I'm not even going to read it. I'll let the article speak to you. As soon as it's finished processing. So I'll start reading, I guess. A 41-year-old man arrested Wednesday for allegedly robbing a Mount Pocono bank in late May, Pocono Mountain Regional Police said during an investigation of the May 29th robbery of the Citizen Savings Bank branch on Route 611. Detectives developed William Curtis of Levittown, Bucks County, who was later employed by Pendle Mental Health Center, as a suspect. Now, mind you, the reason that at the time you could not be a felon and work in mental health is because, please look this up, the guy's name is William Curtis. He was employed by Pendle Mental Health. The reason I know he was employed by Pendle Mental Health is because one of my former clients, he replaced me, one of my former clients, a woman in her mid to late 40s that was heavily medicated on antipsychotics and the perfect victim, was being bullied by him, and he was intimidating her into saying that he was with her at certain times when he wasn't doing anything. He wasn't doing any work, and that was later why he was fired. But when I told her to report this, because she had called me, she was heavily medicated, she was my previous client, this is after I was fired, and she asked me what she should do. So I told her she should call law enforcement, and she should talk to his supervisor, who was my supervisor, a woman by the name of Jennifer Campbell. Jennifer Campbell is now the head of outpatient. It was most likely, I don't know this for a fact, but it was most likely covered up by Jennifer Campbell, who was at the time the head of the TOP and APH program. So what my point is this is another agency with representation. They hire people that abuse vulnerable people, okay, and hire felons to work with vulnerable people, and this is an agency represented at the CSP. Moving forward. So, who runs NAMI of Bucks County? This is going to be important because one of the people that runs NAMI of Bucks County is the CSP coordinator. Okay, you got Debbie Moritz, executive director, Nicholas Ema, associate executive director, Mia Scocozo, youth programs director, Suzanne Ball, supporting programs director, Marissa McKeverican. This is important. She's the CSP coordinator and works for NAMI. Susan Abramowitz, lead support group facilitator. Kate Lange, or Lang, I don't know how she pronounces it, lead support group facilitator. Sky Mandel, office associate. Now, this is important that we understand this, because these people work for NAMI, and NAMI controls, as well as Bucks County, which I will show later, controls CSP. CSP, who claims to be advocating for the public. So what is CSP? Okay, let's take. So CSP is the so-called Community Support Program. It's a coalition of individuals who receive mental health services that will be silenced if they try to speak, as was proven when the last meeting I was in. Their family members, as will be silenced if they don't agree with CSP, as was proven by the last meeting I was in. Mental health providers and interested community members, along with Bucks County Department of Mental Health / Developmental Programs. Now, mind you, Jane Kramer, who I will get into later, covered up the fact that that Lenape Valley Foundation denied me my heart medication and then gave me an overdose of psychiatric medication, okay, and claimed there was no wrongdoing done. Then her underling, Meredith Pickens, basically reparroted everything that that Lenape Valley had stated, and CC'd Jane Kramer on the email that she had sent me. Well, not the email, the letter she had sent me. She just printed out the letter as an email to prove, I suppose, that she was doing her job and covering up the wrongdoings of this agency for Jane Kramer and other people at Bucks County. And until they can prove otherwise, that's what happened as far as I'm concerned. And the only things they've proven again and again and again is they're liars, they are inconsistent, and they're covering things up. So Bucks County, the mental health agencies that hire criminals and sexual predators to prey on juveniles, and CSP and NAMI, a pharmaceutical front group that tries to bully politicians and bribe politicians into drugging people into a zombified state with medications that cause health conditions that will lead to their eventual early demise because of the shit that these medications cause. These are who are supposedly advocating for the public. So their vision is that they envision a county in which a person with behavioral health challenges enjoys the highest quality of life, consisting of inclusion in the community, this is important that you understand this, easy access to choice of comprehensive treatment services and supports. But they're not going to talk about alternative treatment. They're not going to talk about the facts, the orthomolecular psychiatry that I bring up. No, they're going to push pharma. They're going to push unproven psychotherapies like I proved that Lenape Valley uses, like I proved that these agencies use. There is very little hard evidence that any of these psychotherapies work, and there is a hell of a lot of evidence that these psychopharmacological agents are destructive to the brain and to the body of the people taking them. So their mission is supposedly to empower those who attend the CSP meetings, despite literally shutting me down. Miss McKeverican shut me down in the middle of the meeting. Okay, so they're empowering people that are speaking the message that they want spoke. Okay, their goals are supposedly at creating coalitions, and they are, to spread their poisonous message to the public. Okay, they supposedly advocate to review and make recommendations regarding county, regional, state, and national services policies. And this is true. They want to do things like screen children with unproven psychological screenings, which will result in their eventual drugging with medications that will cause them irreparable neurological and other damages to other parts of their body. Okay, that's what they mean by advocacy. Community integration. Yeah, they want you to accept the fact that it's okay if people that are heavily medicated are passed out in a pile of drool in public. Comprehensive services. Okay, they want community-based health services and support systems are comprehensive, available, appropriate, and accountable. No, they don't, or they would have listened to me. Education, to influence and create positive attitudes, behaviors, and knowledges about individuals with mental health challenges. Yeah, they want to normalize these people shuffling around public, highly medicated, and not doing well. That's what they want to normalize. They don't want these people doing well. So what are their alleged principles? Now, I used to have to attend this meeting when I worked at Pendel Mental Health. Okay, that's how I know this. They want person-centered services. Services are based upon the needs of the individual and incorporate self-help, no they don't, and other approaches that allow individuals to retain the greatest possibility control of their own lives. That is not true. They want to stop that. I know that. I know that both from working in the field and I know that from being a recipient in the field. They want you, as long as you agree with everything they're telling you, as long as you agree with downing gobble, you know, fistfuls of pharmaceuticals a day, they're fine with you. The second you start speaking on your own behalf, they will shut you down. Culturally competent. No, it's not. It's not culturally competent. See, racial, ethnic, religious, and gender differences of persons in recovery and their families. They don't. No, they don't. They want this if the person is black or some other type of minority. They want this if the person is Islamic, Jewish, or some type of ethnic or ethnicity, maybe Hispanic. I think they're an ethnicity still. But if you don't look Hispanic, mind you, I'm basically a quarter Brazilian, and I don't count as Hispanic because I don't look Hispanic. Okay? So ethnic, religious, and gender difference. Now, mind you, what's funny about that, Hispanic is not a race. Okay? I've identified as Hispanic on documents and have had it corrected by office staff to Caucasian non-Hispanic. Okay? That's what's ridiculous about it. So I have no say in anything. Okay? Designed to meet special needs. Services are designed to meet the needs of people with behavioral health challenges affected by such factors as age, substance abuse, physical illness, disability, developmental disability, homelessness. No, they're not. Because when they don't care. They don't want to hear any of this. Because if they did, they would have listened to me. They didn't listen to me. So I had medical challenges. I have autonomic dysfunction that was incidentally caused by psychiatric medication that I didn't want to take. Okay, but I have autonomic dysfunction, and I'm on heart medication. I'm on a beta blocker for it, and I was denied my beta blocker by Lenape Valley Foundation at their crisis unit. And then I was put on psychiatric medications despite me explaining to them several times. Now, the only way I got my beta blocker, and the more I look at this, the more I think it's an attempted murder gone wrong. So what happened is my ex-girlfriend had to physically go to my cardiologist and have my cardiologist call over and go, no, he kind of needs that beta blocker so he doesn't have a rebound effect, which could result in him going into cardiac arrest. Okay, and I think they were trying, at this point, in retrospect, it seems to me like they were denying me my beta blocker so that my heart was not healthy enough so that when they overdosed me on the psychiatric medications, poof, I would have been finito. Okay, not Benito. Some people say I look like Benito, but no, finito. Okay, so that was the goal there. Okay, that's what I think. And it was covered up by the county. It was covered up by Jane Kramer. And these people shut me down when I tried to bring that up in a county meeting, an open county meeting. Community-based natural supports. Individuals in recovery are encouraged to use natural supports in the community and to integrate into the living, working. See, this is the thing. They want to normalize the people that have been disabled by high doses of neurotoxins. Services are designed to allow people... Now, and this is the other thing. They say that they want things to be culturally competent. I'm not seeing that here. Not if you're a white American. Not if you're a white American. If you're a white American like I am, your culture doesn't exist. If you're a Hispanic American like I am, and you don't happen to look like a Hispanic according to what they believe a Hispanic should look like, you're not Hispanic all of a sudden. Okay? So, I mean, what the hell? Strengths-based. Services build upon the assets and strengths of individuals and help people in recovery maintain a sense of identity, self-esteem, and dignity. Please see our blah, 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 blah. Okay, moving on. So, as I said, this is from CCHR International, cchrint.org. This is an excellent resource. for people that are fighting the fight against psychiatric abuse. This group was co-founded by Dr. Thomas Szasz, a psychiatrist and professor of psychiatry and a libertarian. I disagree with Thomas Szasz on a lot of things. I do believe people that need help, that need to be forced to have help in certain situations, do need to be forced to have help. I do believe that there are people that do need to be put in mental institutions that are a harm to themselves or the public. But what I do not believe is that the level of abuse that is going on, and that's the problem, is it is a slippery slope, but it's a necessary slippery slope. In my opinion, it's a necessary slippery slope. And CCHR's and Thomas Szasz's opinion, it's not. But the problem is, people need to voice their opinion, feel comfortable voicing their opinion, and voice their opinion loudly, clearly, and not like maniacs. So the Citizens Commission on Human Rights, CCHR, states that it is no wonder that the National Alliance on Mental Health, NAMI, a group that claims, now mind you, Ms. McKeverican is the CSP coordinator and a member of NAMI. The group claims to be an advocacy organization for people with mental illness, opposed to the black box warnings on antidepressants causing suicide for under 18-year-olds in 2004. Mind you, the FDA put these black box warnings on antidepressants and NAMI opposed it. The reason the FDA put these black box warnings on antidepressants is because antidepressants increase the risk of suicide to a point where the FDA does not really even consider them to be that safe. They're not considered safe for use in adolescence, but that doesn't stop people from giving them to children and adolescents and even infants. Okay? And black box warnings on ADHD drugs causing a heart attack, stroke, and sudden death. Okay, the FDA did that. NAMI was against that. NAMI was against a warning on crank. They are literally giving elementary school age children crank. It's the same thing. The only difference is one is in a crystalline form and it's smoked or snorted and doesn't get you high as long. And the other one is in a pill form. It's ingested and goes through the whole system and it gets you high longer. They're literally giving children street drugs, calling them pharmaceutical. They are pharmaceutical grade street drugs is what they're giving children. Today's New York Times article, they're giving, and this is the thing, I am not against complete legalization of all drugs, and I do believe that there should be pharmaceutical grade everything available to everybody over the counter that's 21 years or older. I believe that people that are 21 years or older should have free access, as long as they can afford it with their money, but they should be able to purchase recreational drugs or other drugs. They should be able to get their testosterone, their estrogen, their amphetamines, their whatever. I am not against the absolute over-the-counter access to everything for people that are 21 years of age or over. However, what I am against is the idea that elementary school children are being put on pharmaceutical-grade amphetamines because somebody has erroneously said they can't pay attention. So we're going to crank them up with a drug that's going to cause heart attack, stroke, sudden death, aggressive behavior, hallucinations, insomnia. The list goes on and on and on about what these amphetamines do to these children, but that doesn't stop people from giving them to elementary school children. And NAMI is advocating against the black box warnings, and CSP is not discouraging the prescription of dangerous drugs to elementary school age children. But yet, what's funny is that same organization is promoting addiction counseling because it makes more jobs and makes more money, and it's another funding stream. Everything's about funding streams, funding streams. Well, maybe these kids wouldn't grow up into be adults that are addicted to drugs if they weren't given addictive substances at the age of 6, 7, 8, and even younger, today's New York Times article, drug makers or advocacy groups' biggest donors, a majority of donations made to the National Alliance on, this is from the New York Times, they stated, on mental illness, so NAMI, one of the nation's most influential, they're not an advocacy group, they are a pharmaceutical front group that fiddles with our politics. We need to call them what they are. Okay, have come from drug makers in recent years, according to congressional investigators. According to congressional investigators, the alliance known as NAMI has long been criticized for coordinating some of its lobbying efforts with drug makers. Okay, lobbying efforts. Why are they lobbying? Why are they lobbying? Why are they not encouraging consumers to lobby? They're lobbying, not the consumers, with drug makers. So they're coordinating this with drug makers and pushing legislation that benefits the pharmaceutical industry. This is from a congressional investigation last spring, which is more than that. But Senator Charles Grassley, Republican of Iowa, sent letters to the Alliance and about a dozen other influential disease and patient advocacy organizations, probably also CSP, asking about their ties to drug and device makers. The request was part of his investigation into the drug industry's influence on the practice of medicine. Okay, the Mental Health Alliance, which is hugely influential in many state capitals, okay, and that's the thing, they were bragging about that at CSP. They go to Harrisburg, they do this, they do that. Well, you know what? If you're advocating to drug the public with dangerous substances and to make people believe that disproven and unproven psychotherapies are helping them when they're really hurting them, and you're making money off it, you are not advocating for the public, you are lobbying. You are lobbying for the mental health industry and the pharmaceutical companies, and that's what CSP does, and that's what NAMI does. NAMI controls Bucks County CSP. Okay, and but they refused to they have refused for years to disclose specifics of their funding, saying the details were private. Grassley's office and documents obtained by the New York Times drug makers from 2006 to 2008 contributed nearly $23 million to the alliance, about 3/4 of its donations. NAMI's pharmaceutical funding was first exposed in November 1999 Mother Jones article. An influential mental health nonprofit finds its grassroots funded by pharmaceutical millions. Internal documents obtained by Mother Jones found 18 drug firms gave NAMI a total of $11.72 million between 1996 and 1999. These include Janssen, Novartis, Pfizer, Abbott, Wyeth Amherst Pharmaceuticals, and Bristol Myers Squibb. Now, mind you, on the board of Lenape Valley, you have a, quote, former policymaker from Johnson & Johnson and a current employee from Charles Rivers Laboratory, a laboratory that got caught by the federal government stealing millions in taxpayers' money and committing innumerable acts of animal cruelty, including shooting up dogs with experimental substances and getting them high on cocaine for reasons that don't seem to have been for science, that don't seem to have shown any usable anything. And this is from that's again from a government investigation, and the Department of Justice disclosed these things. So you have basically people that are representatives of the pharmaceutical agencies, research laboratories, sitting on the board as policymakers of agencies like Lenape Valley Foundation that are represented at CSP, who is supposedly advocating for the public when they're really pushing the mental health ideology of drugging and controlling the public to make money off them. It's not even, people think it's about political control, and in many ways it is. A lot of the people that get involved, they get sucked in with the political control and things like that. They want the ability to control people's mindset and control people's outcomes. They're very Pavlovian in that way. They're very communistic in that way. That was why communism put so much time into psychiatry, as I showed in my previous video, one of my previous videos. But the point is, this constant drugging of the public, this constant manipulation of the public. Some people get sucked in for political reasons, to push their radical leftist ideology, their pro-trans ideology, their pro-homosexual ideology, what have you. Prior to it being a liberal ideology, it was a conservative ideology. But ultimately, not only is it taken advantage of by whatever the prevailing political regime is, but what's also being done, and primarily being done, is it's being used to profit off of the public, to profit off of the taxpayers, and to utilize legislators to make laws in favor of the pharmaceutical companies and the mental health industry. And this is who's advocating for you. People that hire sexual predators, people that hire bank robbers, that end up bullying vulnerable people. These are the people advocating for you. Okay? Jane Kramer, who covered up what I stated that she covered up. And until she proves otherwise, that's what I'm going to go with. And they've never proven otherwise, and I have witnesses proving my side of it. They don't have any witnesses on their side. So in a 2000 Insight article, NAMI spokesperson Bob Carolla stated mental illness is a biologically based brain disorder and deferred to the U.S. Surgeon General's 1999 report on mental health as evidence of this. Yet the author of the article, Kelly Patricia O'Meara, reviewed the entire report looking for this evidence and found the Surgeon General's report does not provide a single piece of scientific data supporting mental illness as a brain disorder. And this is true. They claim that it's a chemical imbalance. They claim that it's genetic. They claim this. They claim that. What quote, mental illnesses are symptoms. What's causing those symptoms could be genetic. It could be whatever. It could be a mineral imbalance. It could be a nutrient deficiency. It could be a heavy metal toxicity. It could be that you lost your job. It could be that your wife died. It could be that your dog died. It could be any number of factors, or any combination of number of factors that are causing these symptoms. But the fact of the matter is, the mental, quote-unquote, mental illnesses are not illnesses as is, say, the flu. These are symptoms. The causative factor could be any number of things, but until you actually get down to the nitty-gritty and treat the cause, which is highly individualized based on the patient, okay? And I say patient because this needs to be practiced by medicine. This does not need to be practiced by these armchair politician, philosopher, whatever, capitalists that are profiting off of the abuse of the public, which is what's going on, and this is what's being pushed by NAMI, and this is what's being pushed by NAMI through CSP on the public. Psychiatrist Lauren Mosher, former chief of Schizophrenic Research Studies, National Institute of Mental Health, stated that the National Alliance for the Mentally Ill gets the pharmaceutical money and then says they spend it on their anti-stigma campaign. Again, the anti-stigma campaign to normalize the over-drugging of individuals. They say that mental illness is a brain disease. That's never been proven, and it works. And I've said, you can look at my previous videos where I've stated that with research. That's not only not been proven, there's a mountain of evidence away from that from the National Institute of Mental Health. And it works well for the people who suffer from this use, their blah, blah, blah. This is why NAMI is pushing for forced medication. NAMI is pushing for forced medication. It is an amazing selling job on the part of NAMI. Okay, this is from Lauren Mosher, former chief of staff of schizophrenic research studies. Okay. December 18th, 2003, the New York Times reported that NAMI bussed scores of protesters to a hearing in Frankfort, Kentucky, took out full-page ads in Kentucky newspapers, and sent angry faxes to state officials, all protesting a state panel proposal to exclude the antipsychotic drug Zyprexa from Medicaid's list of preferred medications. Well, the reason why is this drug is dangerous and not proven to frickin' work. According to the article, you have to understand, Medicaid is a government insurance, okay? It's paid for by the government, by taxpayers. The taxpayers should not be, and I support socialized medicine. I support 100% socialized medicine. However, what I do not support is government funding, taxpayer funding. What is socialism? Socialism is an investment by the public in the public. Well, the public should not be investing its money in unproven therapies that do not work and may cause things like aggression, suicide. Why the hell would the public invest in a drug with the side effects that Zyprexa has? Okay, that's not an intelligent use of one's investment money. Okay, according to the article, what the advocacy groups did not say is at the time was that the buses, ads, and faxes were all paid for. They were paid for by the manufacturer of Zyprexa, Eli Lilly. In 2004, NAMI opposed the FDA issuing black box warnings on antidepressants about their increased risk of suicidal thoughts and behaviors in under 18-year-olds. Keep that in mind. NAMI opposed the government protecting you. People like to say the government is out to get you, the government is out to get you. It's not the government that's out to get you, it's these special interest groups that are trying to pervert the government. The government, these protective agencies like the Consumer Protection Agency and the FDA and the USDA and all these, they're trying to protect you. It's these special interest groups that are worming their way into these agencies through aggressive lobbying that are trying to harm you. The FDA wanted to and did issue these black box warnings, and this so-called advocacy group oppose these black box warnings. Now, what's funny is liberals think they have a right to know if their food has been genetically modified. There is no evidence that genetic modification of food is harmful to people. And now, I agree that you should get to know if your food is genetically modified. Okay? And I think it should be up to the consumer whether they consume genetically modified food or not. However, there's no proof that that causes anyone any harm. However, there's a whole hell of a lot of proof that these medications cause people harm, and yet NAMI opposed FDA issuing black box warnings. Would NAMI also disapprove of the Surgeon General's warning on cigarettes? Okay? You have to smoke cigarettes a hell of a lot longer to get the health effects, the damaging health effects from the cigarettes that you would get from these psychiatric medications. In 2006, despite overwhelming evidence of serious adverse cardiac events and sudden death caused by ADHD, NAMI took the position that the black box warning on ADHD drugs was premature. If NAMI was truly a patient, and this is the truth, if they were truly a patient's rights advocacy group, as they purport to be, the question must be asked why they opposed legislation that forwards patients' rights. See, why did they oppose legislation that the government wants to empower the patient to make an informed choice, and NAMI is saying, no, you have no right to make that informed choice. We want to cover this up. We want you drugged with these dangerous substances, and we don't want you to know that you're taking neurotoxins and poison. Take, for example, the Child Medication Safety Act, a bill passed by the House of Representatives 425-1 in 2003. The bill stated that as a condition of receiving federal funds, states develop policies and procedures that prohibit schools from requiring a child to take psychiatric drugs as a condition of attending school. NAMI reported in their policy alerts section. Now, mind you, What the government isn't saying that children can't take psychiatric drugs. That's probably how they worded it. What the government is saying, that the child should not be required to take psychiatric drugs to attend school. So the government is saying, no, you cannot, the school cannot force children to be drugged against their will as a prerequisite of attending a school that receives federal funds, and NAMI opposed that. Okay? NAMI opposed the federal government protecting you and your children from forced drugging, not from educated physicians, from the school. NAMI reported in their policy alerts section of their beginnings newsletter that summer, blah, blah, blah. Despite NAMI's efforts, the bill hailed as protection for parents' rights. Amen. And that'll be all for this video. I will continue with part 2 in a little bit.